my name is Eva. Our group topic today is bipolar disorder. 1 in every 23 people in our country will be diagnosed with bipolar disorder during their lifetime. In our research, we have found a few topics that we felt were important information regarding this disorder. Our findings include what bipolar disorder is, the causes and effects, signs and symptoms, and treatment. First, I would like to explain what bipolar disorder is. It is a chronic illness with two main characteristics. Periods of mania, meaning abnormal high and energetic periods, and depression, meaning having periods of extreme sadness and feeling low. This illness affects more than 10 million Americans. Usually between the ages of 15 and 25 is when more than half of the cases begin. It does not discriminate. Both genders are affected equally. Not everyone with this disorder will have the same struggles either. Some people may have many episodes of mania, while others will only have a few. The length of time per episode can vary from hours to months. The degree and how this illness affects a person can also help determine which form of bipolar you may have. The most common two types of bipolar are bipolar 1, which is the more extreme of the two, and bipolar 2. The person with bipolar 1 has mania episodes, while the person with bipolar 2 has hypomania episodes, meaning their mood is different from their normal mood, but not to the extent that it would appear abnormal. While most people will experience moments in their life where they feel sad or depressed, people dealing with bipolar have a hard time functioning in their day-to-day lives. This is what separates an ordinary person from having a bad day to someone dealing with bipolar. Thoughts of suicide are common among people dealing with this disorder, and it doesn't matter which mood they are in. With the onset of the illness, men usually start with mania mood, where women will usually start with a depressive mood. People that are diagnosed with this illness aren't always having a high or low moment either. There are times when they can lead a normal life. They can function with their families and hold jobs. Because of this, bipolar is a hard disease to diagnose, and sometimes treatment won't begin until years after the first episode. According to research, this condition is the most difficult mental illness for families to accept. Some of the causes of this illness can be explained by Nancy.
Hi, I'm Nancy. I'll be speaking about the causes of bipolar disorder. Bipolar disorder has no single cause. Some people do appear to be genetically predisposed. Brain imaging studies show physical changes in the brains of people with bipolar disorder. The other research reveals that neurotransmitter imbalances, abnormal thyroid function, circadian rhythm disturbances, and high levels of the stress hormone cortisol play a role. Environmental and psychological triggers can also set off an episode of mania or depression. Some of these are stress, substance abuse, medications, seasonal changes, or sleep deprivation. The National Institute of Mental Health published a study in May of this year by Dr. Alan Brown of Columbia University. Dr. Brown's research followed pregnancies of women in a Northern California county from 1959 to 1966. This study compared rates of maternal flu diagnoses with a matched control group. Dr. Brown found a 4-fold increase in bipolar disorder among people whose mothers experienced an influenza infection during pregnancy. Evidence suggested a slightly higher risk if the flu occurred during the 2nd or 3rd trimester. In previous studies, Dr. Brown found a 3-fold increased risk for schizophrenia, which is a disease that shares many of bipolar's similarities. Dr. Brown's recommendation is that women receive influenza vaccines prior to and in the early stages of pregnancy, and avoid people with an infection. Next, Dan will tell you about the effects of bipolar disorder.
There are many effects of bipolar disorder on the individual diagnosed, as well as family, caregivers, and society as a whole. One such effect is the economic toll. Patients with bipolar disorder often lose work productivity or even become unable to work at all, causing hardship for themselves, their families, and their employers. Bipolar disorder is the 6th leading cause of disability worldwide. This affects not only the person with the disorder, but society as a whole, as family members and communities must often help financially. Patients with bipolar disorder often have other chronic illnesses, and this in turn affects their functionality even more. Treatment can also be very costly, up to $600,000 or more for a single patient with bipolar disorder during their lifetime. It is the single most expensive mental health diagnosis, both for patients and for their insurance companies. Some of the effects on the individual that also impact the family are loss of function and decreased quality of life for the patient, which puts extra stress on family relationships. Many patients have marital problems, including divorce, as a result of the disorder. Often, one or more family members become the caregivers, and due to the constant contact with the patient, face even more stress, even at times becoming ill themselves. Patients with bipolar disorder are more likely to attempt suicide and to abuse alcohol and illegal drugs. 25 to 50% of patients diagnosed with bipolar disorder attempt suicide at some point after their diagnosis. Studies have also shown that 56% of patients with bipolar disorder also use illegal drugs, and 44% of patients have comorbid alcohol abuse. Patients having severe manic or depressive episodes may experience psychosis. This can cause patients to have hallucinations, seeing or hearing someone or something that isn't there, or delusions, which can be grandiose delusions about themselves, or make them believe they are being persecuted or attacked when in fact they are not. Now I'll give you to Phoebe to discuss the symptoms of bipolar disorder.
Hi, my name is Phoebe and I am discussing the signs and symptoms of bipolar disorder. People with bipolar disorder may affect a person's functionality at work, school, and home. They experience unusually intense emotional states that occur in distinct periods called mood episodes. An overly joyful state is called manic episodes. An extremely sad or hopeless is called depressive mode. The signs of manic episodes are talking very fast, jumping into one idea to another, having racing thoughts, easily distracted, increasing goal-directed activities, restless, sleep ill, and behaving impulsively. Symptoms of manic episodes are a long period of feeling high, happy or outgoing mood, agitation, and feeling jumpy or wired. The signs of depression episodes are as follows: feeling tired or slowed down, restless and irritable, change in eating, sleeping and other habits, thoughts of death, suicide, or attempts of doing things that they don't usually do. Symptoms of depression episode are long feeling of worry or emptiness and loss of interest in activities once they have enjoyed. Sometimes a person with severe manic or depressive episodes have psychotic symptoms as well, which includes hallucination or delusions. At times, people with bipolar are wrongly diagnosed with schizophrenia. Other signs and symptoms of bipolar can cause range of moods like seasonal changes, rapid cycling bipolar disorder causing rapid mood shifts, and psychosis. Although there are a number of signs and symptoms of bipolar, there are numerous treatments available which Lois will be discussing.
Hi, I'm Lois. One of the treatment research done by the University of New South Wales, I had found that they are looking into applying a mild electrical current to the brain. They also say it was shown to be a more effective treatment for depression. They believe that doing this can improve someone with bipolar day-to-day functioning. There was a short trial study that was 3 weeks, and one of the findings included the tendency for clinicians to treat acute short-term manic episodes with antipsychotics, and long-term mania is treated with mood stabilizers like lithium, which has been around for more than 50 years. In research, lithium has been shown to be more effective when administered early in the course of the illness, and also can lower the risk of suicide. Even though medication is a key thing for a successful treatment, there are other things that can help with the process, which are knowledge of bipolar, therapy, and a support group. With any kind of treatment for bipolar, it is a lifelong commitment with medication and therapy to help with coping with your daily routine and trying to lead a normal life. So in conclusion, today we discussed what bipolar disorder is, what the signs and symptoms are, what causes and effects, and what treatments are available. Recognizing the signs and symptoms and being aware of physiological and environmental causes will assist you and your healthcare provider with diagnosis. In our research, we have concluded that in spite of the negative effects of bipolar disorder, with proper treatment and support, a person can live a happy, healthy, and independent life.